Hey, it's Doc Edwards back with another One Belly, Two Brains Wednesday. I'm going to be talking today about VBAC. That's a vaginal birth after a cesarean. So if you are an expecting mom who is attempting a trial of labor after a C-section, or if you're interested in having a VBAC, this video is definitely for you. Over the last month, we have had a whole bunch of babies born from this office. Since the beginning of April, we've had a little over half dozen, which is a lot for us within this period of time, which means that a lot of our pregnant moms are no longer pregnant. 4 of those babies were born safely at home, and 2 of the babies that we had come out of this office were VBAC babies. And VBAC is really near and dear to my heart. I think part of that might be because I was a C-section baby and my son was also born cesarean. So those surgical births changed the arc of health for those kids. And I've spent a lot of my career trying to figure out a lot of the things that we can do to help shift for those babies, their immune systems and nerve systems and their physiology to counteract how birth impacted them, because birth does matter. We know that. So my opportunity to work with those moms who are attempting that trial of labor is really special for me. And so I've spent a lot of my career trying to understand some of the physiology behind why the first C-section happened. In these 2 cases, they couldn't be more polar opposite as far as presentation. I teach this a lot in the seminars that I do for the International Chiropractic Pediatric Association, but there is a line that we've been developing out of this office for several years now. I've been doing this since 2012. So we've got about 8 years worth of data on all the pregnant patients that have come through my office, looking at their bellies from the side when their bodies are around their 3rd trimester. We've gotten an angle here we call the umbilicus trochanter angle, the UT angle, that seems to be really predictive for us for boring births, somewhere between 20 to 30 degrees from the horizon. Tells us that things are going to go pretty straightforward. And in both of these cases, one of these moms I was taking care of during her first pregnancy late in the game. She came to me with breech presentation. And in the other case, this mother was a patient of another dear friend of mine. And although he's not a pregnancy chiropractor, they were just under general pregnancy care. For both of those moms, we had issues where baby wasn't finding the head down into the pelvis to engage and then be born. So I had to look at what were the different reasons for that. And so for the first patient, what we had going on was a lot of tight core. She was a former college athlete. She works with a standing job. And so her pelvic floor and her core were super, super strong, which was great for her. I mean, celebrate exercise, right? But in terms of being able, if we have a baby not in an ideal position, trying to gain flexibility in there, that's the biggest challenge. So then you throw on top of that the additional challenge of scar tissue, right? Because after a surgical birth, we're going to have scar tissue in the lower area of the abdomen and in the uterus. And so watching her UT angle as she progressed through care, a big focus for us was the ability to make sure that her abdomen was releasing properly, so that as her baby was coming down into the pelvis, it's kind of like you can imagine the butt of the baby sticking out here in the belly and the head getting engaged in there with the cervix. So if we have a good angle in there and we're not too high, then that's going to, according to our research, mean that we're going to have a pretty straightforward birth. And in fact, she barely made it to the hospital. She got into the hospital at about 6:45 in the morning, and baby was born about a half hour later. So that was pretty amazing. I don't necessarily like freight train births, but a big difference from what she had the first time. The second mom had the opposite thing going on. So for this mom, she's developed a very, very, very tight, strong pelvic floor. And so as a result, baby doesn't necessarily get down in the pelvis, but kind of shoots out in something that we call a pendulous abdomen. So that means that the baby's below that 20 degrees from the horizon line. And baby stayed that way. That's rare for us. We generally will be able to have a pendulous abdomen go back up through doing things like rebozo sifting or some ball work, having the mom shift her pelvis right and left, forward and back on a stability ball. All that kind of good pelvic activity and a lot of fascial releasing generally will help baby tip a little bit better to get engaged with the cervix. So since she was below that angle, I made sure that her doula, who was attending her home birth with her, knew that there were a couple of things that she could do. Things like the abdominal lift and tuck, making sure she was doing the rebozo sifting during labor. Sacrotuberous ligament releases. That's a ligament between your sit bone and your tailbone that I found has been really important to release during birth. For those of you who attend as birth professionals, as chiropractors, as as doulas. It's worth getting to know that anatomy. So for this mom's birth, things again went very straightforward. She had the capacity to dilate with her first birth. She had dilated 10 centimeters, so we knew her body could do that. But this time around, absolutely, dilation happened. Baby came through the canal and was able to be born at home there in the water. My friend Megan, who had attended that labor, she said she barely had to do anything. This is one of the first times that she could just kind of, instead of using her hands all the time, she could use her voice and coach her through that birth. So what a great outcome for both of those moms and both of those babies. There's something really important to take away from this, and that is that chiropractic can be very, very beneficial, not only in helping during a labor and a birth, but what I've been advocating for a very long time is that banking that kind of nerve information so that when your body's ready to bloom, when your body's ready to bring that baby down and engage with the pelvis and then bloom open to allow the baby to come earthside, that the things that you do as a VBAC seeking mom are really, really important during this pregnancy. I find myself during that third trimester reassuring a lot that this mom has now had different balance in her pelvis. She's got different amounts of nerve communication. We've been doing different activities than she did during that first birth. Sometimes the big adjustment is in between the ears, right? It's getting into the mindset that, hey, listen, I know I had an experience that wasn't ideal last time, but this time things can be different. And being able to prove that over and over and over again out of this office, seeing that in the other chiropractors that I know that attend these labors, that taking care of those moms who are attempting those births after prior C-sections, we have the experience to know that these kinds of stability creating, salutogenic inducing, nerve system firing, exercise forward leaning inversion, sideline release, rebozo shifting activities all have a benefit. But there's definitely a purpose to being proactive rather than just hoping your body does it this time. And so if you're interested in finding providers like us, here locally, Mama's Chiropractic obviously is your go-to resource, but the International Chiropractic Pediatric Association has an entire catalog of chiropractors who have gone through the training. I teach for the ICPA. I teach other doctors how to do the things that I do every single day here in this office. And there are lots of chiropractors that have been trained, not only US, but Canada. I've been over to Europe. I'm really, really excited for those moms who are trying to do this a second time around to get engaged with the chiropractor who's done that kind of training so that they can have a different outcome this time. So thanks a lot for joining us this One Billy Wednesday. Remember to subscribe. We're constantly doing videos. I also do some content, some written content on our blog, Mama's Chiropractic. And we are going to also be streaming every Wednesday, both here on Facebook and here on YouTube. And so make sure that you set your clocks. We've got this whole video thing figured out now. We've got everything dialed in nicely, so we ought to be able to have this at a regular time. What we're finding is that 6 p.m. on Wednesdays is going to be the time that we're going to be doing these lives. So I was really excited about that. This has been a long time in the making, a lot of experimentation. Thanks to you guys for sharing these videos, because I know that it's reaching other people. I'm getting the feedback, I'm getting the questions, I'm answering them as fast as I can. I really, really appreciate each and every single one of you who tunes into these. So make sure that you're sharing with your friends. I know it's a scary time right now where moms don't necessarily know, do I have all the options to do and have these kinds of things? And let me tell you, there's never been a better time to make sure that you're getting into a chiropractor who can take care of you. A lot of these times, moms will come in really late in the third trimester. I have to say, from the evidence, and again, from what I'm trying to share with you this One Billy Wednesday, by all means, please make sure by the beginning of your third trimester, you're into a perinatal chiropractor, because it definitely changes your outcome.